हो ना. लावा ना जरा एकदा. माझा आवाज येतोय का बघा. फक्त आवाज येतोय का ते चेक करायला. येतोय क्लिअर. म्हणजे असं कमी वगैरे असं नाही ना. ओके आहे ना आवाज.
If you were born between 1980 and 2000 to access Max like a solid term plan. For
शेयर केलं तरच जायला हवं. येतं का बघा. शेअर केलं तरच जायला हवं.
Hello, mic testing.
Uh, yes. Able to hear me? Okay. Fine.
A very good afternoon to all the respected dignitaries, faculty members, esteemed guests, and dear participants present here with us today. I, Ms. Aradhna Eli Rao, MSc Nursing second year passing out batch, and
I, Miss Maggie Mariam, MSc second year student. We are honored here to host you for this special webinar organized on the occasion of World Breastfeeding Week 2025. Today, we all gathered here to emphasize the importance of breastfeeding, reflect on this year's theme, that is, prioritize breastfeeding, create sustainable support system, and learn from our distinguished speaker. Before we proceed further, we would like to take a moment to express our heartfelt gratitude to our principal ma'am, Dr. Prabhake Dasila, whose constant support, vision, and inspiring leadership have made today's webinar possible. Thank you so much, ma'am, for being our guiding light in all academic and professional endeavors. Dear participants, your presence today reflects your dedication to maternal and child health, and we sincerely thank you for being a part of this event.
to begin today's proceedings, we would now like to invite Mrs. Maria Preeti Matthew, Professor and Head of Department Obstetrics and Gynecological Nursing, MGM New Bombay College of Nursing, Kamote, for welcome address and unveil this year's theme. Over to you, ma'am.
Good afternoon, everybody. Okay, behalf of MGM New Bombay College of Nursing and the management, I take this opportunity to welcome each and every one of you for this national webinar with the theme of prioritizing breastfeeding, create sustainable support system. The Department of Obstetrics and Gynec had 7 days of various activities, and the last day we are here for the national webinar. The main aim of this webinar is to provide comprehensive information on breastfeeding to the students as well as to the clinical nurses to enhance the breastfeeding friendly environment in the hospital. So this year's theme, that is prioritize breastfeeding, create sustainable support system, mainly emphasizes on the long-term, accessible, as well as equitable support structure to empower the breastfeeding mothers and to promote breastfeeding as a key aspects of the maternal as well as child health. So this particular theme is divided into 2 aspects, that is prioritizing breastfeeding, and the second one is to create sustainable support system. Prioritizing breastfeeding, this tells or this calls the urge or urges the government, healthcare system, workplace, as well as communities to take a higher values and to support the breastfeeding and create a sustainable support system. It focuses on building long-lasting structures to make a breastfeeding friendly environment. With this, I will open this theme for a day, and we have on this webinar, we have a 3 distinguished resource person, Dr. N. Gayatri, Professor and HOD Department of Obstetrics and Gynae, Bangalore, St. John's Medical College. The second one is Dr. Mrs. Samriddhi, Associate Professor, Sadhu Vaswani College of Nursing. And the third speaker is Dr. Rupali Jain, Assistant Professor, Department of Pediatric, MGM Medical College Hospital. So these three are talking regarding the various aspects of breastfeeding, its importance, challenges, as well as how to, what is the rightful of normal breastfeeding for the mother as well as for the newborn baby. So I take this opportunity to welcome all three distinguished resource persons, and I now hand over the mic to the Mrs. Aradhana Eli.
Thank you so much, ma'am, for the warm welcome and for unveiling the theme. Your words have set a perfect tone for today's session. Let's move forward to line up to our expert speakers. Our first speaker is Dr. N. Gayatri, Professor and HOD of St. John's College of Nursing, Bangalore. Ma'am has completed her BSc Nursing from CSI Jayaraj Annapikam College of Nursing, Tamil Nadu. Ma'am has completed her MSc Nursing from Sridevi College of Nursing, Tamil Nadu. And ma'am has completed her PhD Nursing from Savita University, Chennai in the year 2024. Ma'am has over total 20 plus years of experience and over 8 publications in national and international journals. Ma'am has attended and conducted various workshops and conferences. Ma'am has been the resource person for various workshops, PG research guide since 14 years, and ma'am has conducted various projects inter and intra-departmental level. Ma'am, we give you over to you. Please start the session. Thank you.
Yeah, good afternoon, and thanks for inviting me as a speaker here, and thanks for that warm introduction also. I would like to know whether you are able to see the PPT.
Yes, ma'am.
Yes. Okay, good afternoon once again to everyone. And I'm very happy to the management of MGM College of Nursing, Mumbai, for inviting me as a speaker for this webinar. And I'm proud. I'm also a mother. To be a mother and to take part of in healthcare, encourage the mothers for the breastfeeding and nurturing the children. With that, I'll just start because it is given only half an hour of time, and I'll be dealing in this session mainly about the importances of breastfeeding for both mothers as well as the newborns. Am I audible? Can you just check it? Am I audible?
Yes, ma'am, we can hear you.
Yes. So my objective for this session, importance of breastfeeding for mothers as well as importance of breastfeeding for the babies. Breastfeeding. 1 minute.
कौन सा वाला?
ये नीचे जो है ए मेरा ऊपर हो गया
नंबर में दी है।
I'm just adjusting. Sorry. Wait for some time. Okay. Fine. Okay. Breastfeeding, it's a natural and profound bond between a mother and child. This session mainly to aim at educating the mother and inspiring the participants with the immense benefits of breastfeeding for infants, mothers, families, and society as a whole. Because as a healthcare team members, it is our important role or important work, I can say it is vital role we are playing in mother's life, because it is our responsibility to inspire the mothers and educate them with the importance of breastfeeding for both mothers and babies, so that they will adopt and they will accept what and continue the breastfeeding. And it is not that, even WHO says, it is not that only 1 year of breastfeeding is enough. Beyond 1 year also, the mother can give the breastfeeding up to 2 years. More than that, if she wants to give, it is well and good. The theme of this year, every year we are celebrating World Breastfeeding Week, August 1st to 7th. So the theme of this year, 2025, Prioritize Breastfeeding, Create Sustainable Support Systems, which is very important. As a healthcare worker, it is our primary goal to create and to support the mothers in breastfeeding. Exclusive breastfeeding, all of us will know what is exclusive breastfeeding. Exclusively 6 months the breast milk has to be given to the child. But are we achieved? Still, it is a query. So, with that note, I'll go on with the benefits for breastfeeding for the mothers and the babies. This theme highlights the importance of building robust and sustainable support systems to make breastfeeding accessible and beneficial for all the mothers and the babies. Breastfeeding delivers a hopeful future not only for children but for societies, and it reduces healthcare costs, boosts cognitive development, strengthens economies, and sets children up with the healthy beginnings. Just a brief information about the composition of breast milk. As we all nursing fraternity, we will be knowing it, but still, I just wanted to highlight the points of composition of breast milk. It contains hormones, growth factors, which promote optimal development of the infant's organs and tissues. And it has innumerable IgA, IgG, and IgM, and also human milk oligosaccharides, which is present in the breast milk, which serves as a prebiotics, which helps to nourish the beneficial gut bacteria in the infant. And bifidus factor, which is the lactobacillus bifidus, which helps again to the newborn. And lactoferrin binds to free iron. Stem cells, which is another important thing which we have in the breast milk, have the potential to regenerate and repair the infant's tissues and organs. It is perfectly tailored to meet an infant's nutritional needs, containing essential proteins, fats, carbohydrates, vitamins, and minerals. So we no need to buy or buy the supplements like minerals, vitamins from outside and give it to the baby. Breast milk contains everything. Breast milk provides invaluable immune boosting antibodies which protect the baby from illnesses and any kind of infections. Breast milk contains digestive enzymes which aids the infants to develop the digestive system so that the baby will not have any digestive problem, and it helps for the proper growth and development. Moving on to the breastfeeding benefits for both baby and the mother. First, I'll be dealing with benefits for the mother. Of course, it helps for the release of oxytocin. We know oxytocin, how it helps for the involution of the uterus. So for the mother, it is a great help during the postpartum period. When the baby suckles, the oxytocin is released. It helps for the breastfeeding and for the involution of uterus by acting on the myometrium. So that is one of the important things when the involution process takes place properly during the postpartum period. It helps the mother to be at ease because she is having her normal postpartum period, which helps her to concentrate and take care of the baby. Next one, if you see, it helps to reduces breast and ovarian cancer. Of course, some mothers, still we are in the modern era. Some of the ladies will think that, okay, the shape of the breast will change if I breastfeed, or my figure will change, all that. So it is our duty to make sure that to remove the myths among the women. It is very important, and we have to make them to understand breastfeeding helps to reduce the breast and ovarian cancer, reproductive cancers, so that they will be encouraged to give the breastfeeding and to continue the breastfeeding. And also, breastfeeding acts as a natural birth control. You must have heard about the lactational amenorrhea. Of course, it helps to control the birth, so no need of searching for the another family planning methods during this postpartum period. And another important aspect, if you look at the benefit of breastfeeding, psychological well-being of mothers, it helps in various aspects, especially to reduce the postpartum depression and anxiety. And I would say, more than the reduction, it helps to prevent the postpartum depression and postpartum anxiety and postpartum psychosis. To quote with this, I have found one study, just wanted to bring it to your notice. The psychological benefits of breastfeeding, fostering maternal well-being and child development by Anushri Modak et al. This study had given the numerous findings regarding the psychological impact of breastfeeding on mothers. And they have said, findings of the study said that none of the mothers developed even the postpartum blues or mood swings, nothing, who are breastfeeding. And they have said who are not breastfeeding had some symptoms of postpartum blues. So it shows that it has numerous psychological benefits when the mother keeps feeding the baby. Moving on to another benefit for the mother, it increases the self-esteem and maternal confidence. Of course, as a mother, when I am feeding my baby, I feel that the self-satisfaction. Yes, I had fed my baby. I had fed my baby with breast milk, and baby is sleeping, baby is gaining weight. What else I need as a mother? So it helps the mother to increase her self-esteem and the confidence how to take care of the baby, and it gives the sense of accomplishment and empowerment. So a mother can say proudly that yes, I have achieved my role as a mother. Maternal role achievement takes place here. It may not happen with the mothers who are not feeding the baby. It may not happen. It will happen. The mothers who are feeding the baby, who are breastfeeding the baby. So that sense of accomplishment and empowerment, even I could say n number of examples from my own clinical areas. Every day when I meet the postnatal mothers, I ask them, how are you? Are you feeding the baby? Is there any difficulty? Of course, we know, especially the primary mothers will have lots of problem with adjustment of their own physiological changes and the newcomer in the family with the fatigue, all that. So when we go as a health personnel, when we go and interact with them, we will get to know. And I'm so happy that even my students also doing a wonderful job in postnatal ward, teaching the mothers how to feed, the positions and the importance, everything. And when I interview the mothers, I get the information which satisfies me that they are good enough, they understand the importance, and also they are willing to continue the breastfeeding. So that shows the spirit of the mother also. But it is in our hand to make them to understand how it helps for her as well as for the baby. That is very important. And when we say, if you look at this picture, the confidence in natural motherhood, it's not that simply what the baby wants to give. It is our responsibility to feed the baby. So we are raising a good citizen for the society. because it increases the bond between you and the mother and the baby, as well as it helps to improve the IQ level for the baby. I come a little later for the baby's benefit. So ultimately, we are bringing up the good citizen to the society. That itself, again, it increased my self-esteem. Yeah, I have brought up my child in a way that my child is a good citizen in this society. So the increased self-esteem and a sense of accomplishment and empowerment is another major benefit I could say for the mother. And also it promotes responsive parenting because it increases the bond between the child and the mother. So it is not that easy to create and continue the bond between the mother and the child. Breastfeeding helps for that. During breastfeeding, when the mother speaks with the child listens, may not respond by word, but it responds by smile or some cues. Okay, so it promotes responsive parenting and also it fosters the maternal caregiving and bonding, which is very important. The bond between the mother and the child, it's not just creating the bond, and it should be sustained. That is very important, which helps again for the family as well as for the society. So it is very another important benefit, I can say, promotes responsive parenting as well as the bond between the mother and the child. Breastfeeding catalyzes fostering body positivity and self-acceptance with the postpartum phase. All of us know lots of physiological changes the women will undergo during the pregnancy as well as during the postpartum. Her body changes will be there. Breastfeeding catalyzes that, the positivity among the mothers. Again, she accepts herself. Whatever changes happen in her body, she accepts herself in the postpartum phase and she take it positively and she go ahead with the nurturing of the babies. That is another aspect we can say catalyzes the body positivity. I mentioned sometime before that nowadays in the modern era, some of the ladies or women will not have much, will not be okay to feed the baby because of the changes, breast will sag, all that. They will think like that. But this breastfeeding, once they start, it helps to boost their positivity so that they will accept themselves. The self-acceptance will be there, and whatever changes comes, they will be able to cope up with that. And they will be able to cope up with the postpartum period, both physiologically as well as psychologically. That is a very important benefit for the mother to accept herself as a mother and accept herself to take care of the baby. So these are the benefits of breastfeeding for the mothers. We can say another n number of benefits psychologically, physiologically, but I have put here mainly the important points because all of us we know the benefits of the breastfeeding. Next, moving on to the benefits for the baby. When you look at the baby, this picture, when I looked at it, I was feeling very happy. Yes, of course, mothers also will be very happy. Everyone wants a healthy child, not only in the newborn period, even later. So breastfeeding helps for that healthy newborn and healthy citizen. Reduces the risk of infections, SIDS, obesity, and chronic diseases. Of course, in the beginning slides I have shown and I have mentioned it, it has immunoglobulins. It helps to reduce the risk of infections and obesity, chronic diseases. It is like a long-term effect on the babies. So exclusive breastfeeding is very important. When we go with formula feed along with the breastfeed, it may not help that much. we have to explain that to the mother to go with the exclusive breastfeeding and tell these importance to them. See, we are learning through these webinars, conferences, seminars, all through the books. But how much we communicate these things to mother, that matters a lot. When we educate them, they will understand. I won't say in one, when you go to the mother and teaching them on the first time itself, they will accept everything. It will take time, but they will understand. So the first benefit I could say, it reduces the risk of infections, SIDs, and obesity and chronic diseases. Since it has all the immunoglobulins in the breast milk. Next, if you look at, it helps for the cognitive and emotional development of the child through the maternal interaction. Of course, breast milk helps a lot for the cognitive and emotional development. IQ level will be increased and emotional development when the mother interacts during the breastfeeding with the baby. Definitely, it helps to develop the emotional bond and development in the child. Optimal growth and development. Definitely, we know the milestones which we learn in the pediatrics, but in the newborn period also it is very important. So breastfeeding, it helps for the optimal growth and development of the child, both physically, mentally, emotionally, everything. And it improves the mother and child bond. I mentioned this benefit in mother's benefit also. Here also I would like to foster it because it is very important one. Between the bond between the mother and child definitely will be improved with the breastfeeding. And mother also will have that self-accomplishment. Baby also will feel satisfied. You can make out that from the sleeping hours and no cries. From those signs, you can understand that baby also satisfied with the feed what is given. And bond, it will start to speak with the mother. Of course, the eye contact, smile, touch, and cuddling, all this will make the baby more comfortable as well as more satisfied. That helps for other developments also. Next, other benefits. If you look at for both the mother and child, stress reduction. Of course, it helps because when the mother feels everything good about herself, yes, I'm the mother, I'm able to feed my baby well, I'm able to take care of the baby well, her stress will be automatically reduced. And when she feeds well, when the baby gets adequate amount of milk, baby also satisfied. So baby also will not have any stress. Not only the psychological aspect, any other physiological aspect also. It helps to reduce the stress for both mother and the child. If you go to the clinicals, look at the mother and the child. From their face itself, we can understand how much stress they have or they are stress-free. And especially soon after the breastfeeding, just observe the baby's face. It will be very calm and quiet, and some babies will start sleeping also. That shows that how much it is satisfied and how much it is happy. And some more other benefits also I would like to mention here. Peer support and sense of community among breastfeeding mothers will help them to know the various aspects of breastfeeding, the positions, techniques, all that. So in your clinical areas also, we can make opportunity for that to have the peer group discussion so that each mothers, when they talk with each other, it will help for them to know and to understand better. Uh, for example, when I go as a lactation counselor or something, I go teach and come back. But when you make like a discussion with the peer mentors, with other postnatal mothers, it helps them a lot to understand, to verbalize their difficulties and to understand how to manage that one. And breastfeeding frequently catalyzes the formation of nurturing communities among mothers who share similar journeys. So, this again, the peer support groups discussion will help how they are carrying over their journey. Through the peer support groups, virtual discussion forums, and physical gatherings, breastfeeding mothers find a platform to connect, exchange insights, and narrate their narratives. So they can discuss among themselves their problem, baby's problem, whatever they are um, facing it, and they will get the solutions also. Apart from the healthcare workers, education, this also will help them to understand better. And if you look at the benefits for babies, again, few more points to say that it helps for good digestion because breast milk, we know that it has its own enzymes and the composition says which helps for the digestion. It has the component which helps for the digestion. So baby will not have any problem like a diarrhea or constipation, all those things. So ultimately, when we look at the benefits of breastfeeding, it helps, it promotes the health of the baby and the mother. It prevents some of the infections, diseases, and also it has the long-term effects to prevent the chronic diseases in the child. And for the mothers also, long-term effect to prevent the cancer, it helps. And moving on to the benefit for family. Few more slides only. So we finished with the benefit for mothers. Next, I just discussed with the benefit for babies and breastfeeding, how it helps for the family. Definitely, it saves families money on formula feeds and also medical cost and promotes the family cohesion. Absolutely, I agree with that because no need of spending money for any formula feeds when we go with the breastfeeding, especially for 6 months exclusive breastfeeding. Maybe later on we have to start with the weaning, but before that, it helps to save the money. And when the mother is feeding properly at regular interval and whenever the baby demands, the duration of hospital stay also can be reduced. Again, it reduces the cost. So family also benefited. It reduces the money for formula feeds and medical cost, and of course promotes the family cohesion. Because when the mother is feeding the baby, of course mother only has to feed, but she needs support from the other family members. She needs some space. She needs to be free from her work. If she is a working woman, that adjustment, working hours adjustment have to be done. And at home, household work will be there. From that, she has to be excluded. That helps her to engage her and help her to complete the breastfeeding sessions at regular intervals. That is how the family helps her and the breastfeeding helps the family. And the last part of the benefits is benefit for the society. It contributes to public health, environment, and economy through the reduced health care cost. And also, we are nurturing the good citizen to the society. Later stages or later years, that good citizen, when that person is in the society, they will take care of the society also. And it helps the child, mother, family, and the society. So, this much time, what I have discussed is regarding the benefits of breastfeeding for mothers, for the newborn, for the family, and for the society. If you look at book picture, they must have given only the IgA, the enzymes, all that. But if you look at in a broader way, family and society benefit also equally important. And it is not only 6 months. It can be given, breastfeeding can be given beyond 1 year up to 2 years also. Even I know a mother who fed the baby even up to 4 years. There is nothing shame on that. How much they are able to give and how much the family supports for that. That is important. So, with this note, I would encourage the healthcare team members, professionals. Please educate the mother about the importance of breastfeeding, both mothers and the babies, so that they can feed the babies without any regrets or without any hesitation. That is very important. And teach them exclusively 6 months only breast milk, nothing else. After that, they can start with other weaning. And when we say the importance, okay, these are the importance for the babies, make them to understand in a better way. For the healthcare members, when we are telling about, okay, this helps to prevent the infection, this, that, and all, fine. But when you educate the mothers, make sure how much they have understood and how much they are willing to practice that. That is very important. Get the acceptance from them and ensure that they are practicing it. That can be done even through some phone calls, some WhatsApp groups, you can make it and do it. Because the theme is support systems, also very important. Since my topic is only the benefits, I'm trying to finish up with this. And later, other speakers will talk with you or discuss with you regarding the challenges and what are the support systems we can provide to the mothers for the good breastfeeding sessions. Okay. So the last one, which I wanted to say, the WHO, what they have given in one article, continued breastfeeding for the healthy growth and development of children. So they said the recent evidence indicates the globally prevalence of continued breastfeeding at 12 to 15 months has decreased. So again, dear healthcare members, you ask yourself how much we are educating the mothers about the exclusive breastfeeding and how long to continue. It has decreased from 76% to 73%, with the rate of 12 months reported to be highest in Sub-Saharan Africa and South Asia and Latin America. And also, the decrease in prevalence appears to be driven largely by changes in breastfeeding practices among those with lower economic status, both within and across the countries. Though mothers with lower socioeconomic status still tend to breastfeed for longer than those with the higher. So that shows that lower economic class mothers were continuing the breastfeeding for longer duration comparing to the higher socioeconomic class. This trend would suggest that as income increases, the mothers may shorten the duration of breastfeeding or otherwise negatively modify the breastfeeding practices. Of course, we can understand the practical difficulties of working women, and even though government guidelines have given 12 months of maternity leave, 6 months of maternity leave, after that they have to resume to the work. So they will have the practical difficulty of continuing the breastfeeding. But as a healthcare member, it is our duty to encourage them to continue to find the way out, how they can help themselves, how they can get the helps from others, and how they can continue the breastfeeding. It will help them for the mothers, as well as it will help for the babies, and it will help for the family. Okay, so with this note, I would like to end up my session, and thanks for that patient listening. Hope I have kept the time limit which is given to me. If you have any queries or any clarifications, feel free to ask me. Any queries, any clarifications?
If any of the students have any queries, you can please go ahead and ask now. Thank you so much, Dr. Gayatri ma'am, for your thorough and practical insight that has given importance to breastfeeding for mothers and babies. It was truly enlightening, and we are sincerely grateful that you have taken the time to be with us today. Your words have not only deepened our understanding, but also inspired us to look at breastfeeding as a vital part of maternal and child health. We want to thank you for connecting the theoretical and clinical experiences that made this session not just informative, but truly impactful. Thank you once again, ma'am, for your time, your expertise, and the compassion that you have brought with us from your seminar today. Thank you so much, ma'am.
Okay. Once again, thank you for asking me to be a speaker, and thanks for patient listening also. As a
Thank-
healthcare member, we would do our good work and we will continue our good work. Thank you all.
Thank you so much, ma'am.
Thank you.
That was indeed a beautiful session. Our next speaker we have with us today is Dr. Mrs. Samruddhi Bhakare, Associate Professor, Sadhu Vashwani College of Nursing, Pune. We welcome you, ma'am. Ma'am has completed her PhD in nursing from MGMIHS in the year 2019. Ma'am has completed her MSc Nursing from Child Health Nursing in 2010. Ma'am holds a clinical experience of over 10 years and a teaching experience of over 17 years. Ma'am has a total of 12 publications that are 3 international, 7 national, and 2 peer-reviewed chapters. Sorry for the inconvenience. Ma'am has won the Avishkar Award, that also another 5 prizes in paper and poster presentation. Ma'am was awarded second rank in MUHS Avishkar in the year 2019. Ma'am has won the first prize in paper presentation at International Conference on Neonatology, September 2007. We welcome you, ma'am, and thank you for your presence here. Over to you, ma'am.
Thank you so much. There could have been a short introduction, okay? And I hope I'm audible.
Yes, ma'am, we can hear you.
Okay. So, you want me to keep the video on? Because there is a little disturbance if I put the video on. Is it okay?
Ma'am, whatever is convenient with you.
Okay, okay. But I want the audience to be attentive.
Yes, ma'am. Yes, ma'am.
Okay, okay. First of all, thank you so much. And I'm very happy that my MGM, I've completed my PhD very ideally, and I've really developed, when I did my PhD from MGM. And I'm really thankful to the complete MGM IHS family. And I'm also very happy that they still remember me and they call me for the webinars. And it's always my pleasure, to do something for my PhD institute. I thank the webinar team as well as our respected principal ma'am and the university too. So without wasting any further time, I'll start with my presentation. So the topic given to me was, of course, it is right to respectful breastfeeding and creating a breastfeeding friendly environment. So the previous speaker, respected Gayatri ma'am, has talked about all the benefits. So, when there is a benefit, the benefit comes only when we all work together, okay, united, and the outcome also comes out to be very good. So that is why we need to support. And if you remember, since 2020, we are been on the theme, sticking to the theme of creating awareness about how important is the breastfeeding. Last year also it was like, the breastfeeding, a sustainable chain has to be there. But this time the theme is, talking about how do you create a friendly environment through sustainable support system. Can I have the next slide, please? So this is just enter it, and then the theme, I just wanted to review the theme, that is prioritize breastfeeding and create sustainable support system. So in this presentation, we are going to see how we need to keep it sustainable as well with a very good support. And it's not only the mother's responsibility, but when she gets support, number one, from the husband, that is the father of the baby. Then second comes the family, and then the complete society, as well as we as the healthcare workers need to be very active to give a support, or to continue this support system. So it's not that when we celebrate the World Breastfeeding Week, so chalo, right from 1st to 7th August, we create awareness and then it's all over in 1 week. No, that is why it has been given that we need to continue for a longer time. We need to continue, over a period of time. We need to update, but that chain has to continue. Okay, so today is the last day of the World Breastfeeding Week, but we may be very active in this first 7 days, but we need to continue this chain. So that is, we need to understand the word sustainable. We have to keep on going. So, for every mother, every new mother, okay, as nurses, we are giving care, or as health workers, healthcare workers, we are giving care regarding breastfeeding or care to the mother and child. Our sustainability has to continue. It has to go on. Rather, it has to, our support system has to be still continue to be more stronger. So we will just see, I'll just specifically talk about it starts the support system from the family into the society and, a complete country as well as the world. Next slide, please. So prioritizing breastfeeding. Okay, so this aspect urges governments, employers, and healthcare providers to make breastfeeding a top priority in their policies and practices. Okay, so we have to prioritize breastfeeding because, as previously also ma'am said, that our newborn is going to be a future, a good future, is the future of a country. Okay, and if we prioritize breastfeeding, we are going to have healthy children. We are going to have healthy youngsters who are going to work for the country. So we are going to have a healthy, people working for our country. So obviously it is benefited to the country also. And creating a sustainable breastfeeding support system, as I already told you, sustainable, we must remember that don't do it only when we are celebrating World Breastfeeding Week, but this has to be sustained every day. Okay, this has to go on for a long time. Okay, as far as we are with the mother, when she's delivered, we are taking care of the newborn. We also have to help her out. We also have to encourage her. We have to create a friendly environment. We have to support her. All this needs to be continued for a longer time till the mother is with you, till the baby is getting adequate, or the mother gives breastfeeding to her baby. So a sustainable breastfeeding support system is an all of society approach. Okay, it's a round approach. It's an overall approach that ensures that every mother gets the support. There is a very good environment. It is not only related to the nature, it is not only related to the physical, but the most important is how the environment around her makes her to be mentally stable. And with that environment, with that healthy environment, when she's mentally stable, okay, she continues to have her active breastfeeding. So this environment includes the nature, the physical, as well as the surroundings. So support environment and resources to breastfeed successfully. Right from the time of conception, it's not that when she delivers, she has got the newborn and you have to start, or you are with her to start with the breastfeeding. Right from the time she is conceived, she is become pregnant. Okay, we have to talk about, or we have to start supporting her, because even antenatal period is the most important period where she should have a very good diet. She should be physically and mentally, happy. The environment starts right from the antenatal period. So it is from the conception through the first 2 years of the child's life and beyond. Okay, so we have seen that mothers, even they feed their children till 4 years of age. So this has to continue. The support has to continue till the mother is doing the breastfeeding or related to the nutrition of the child. So support for breastfeeding must begin in the antenatal period, and we are the first people to whom the mother is exposed. So we are there to, start about giving her idea about the breastfeeding, how important it is, and how she needs to prepare herself, and how we are going to support her to prepare her to be a, healthy mother, and to since a healthy mother, to give birth to a healthy baby, and after giving birth to a healthy baby, to keep the baby healthy. So this is, right from the antenatal period till the baby is growing under nutrition. So we are the first people who are exposed, or we are the first one in contact with her. So with health worker trained to provide a clear, reassuring and skilled guidance. So not only talk about theoretical part about the breastfeeding and importance, but also there are various techniques which we all learn in our a profession. Okay, there's various skills and techniques of breastfeeding. So even that skilled guidance has to be given to the mother. She has to be taught about the importance, the various techniques, how she needs to continue her chain of breastfeeding. And there are very small and important and easy tips that we need to give her, we need to teach her. So on to keep a sustainable breastfeeding period. Next, please. So there are certain core components. Okay, so social norm promotions are there. Community-based support. This core components of support system is given in collaboration, WHO in collaboration with UNICEF. So they are saying that social norm promotion has to be there, okay, because mother, baby, they are also an important part of the society. So there are certain norms we need to promote, and these norms are all related to giving a friendly environment to the mother, okay, to make the mother confident, to make the support the mother and create a friendly environment. So social norm promotions are being given. We will see that community based support. So mother is again an important part of the community. So the support has to be given from the society and from the community. So community-based support, it is in the form of family, okay, the neighbor, the region where she stays, the healthcare centers, okay. This all comes in the community-based support. Environmental and climate sustainability, okay. So the environment also, or the nature also, has to be taken care of, okay. And when breastfeeding is there is no any, there is very better economy. There is no any use of, the waste which damages the nature. So environmental and climate sustainability is there. Workplace and social protection. If we see nowadays, we have got maximum of working mothers, okay. So, once they deliver or if they are in a period of exclusive breastfeeding, of course, the government, or as per the act, mothers do get 6 months maternity leave, okay, but one fine day she has to join back her work, okay. So till then also her baby will be doing breastfeeding. So there will be certain workplace and social protection norms which needs to be followed. So this also becomes a very important component in your support systems. Next is health system integration, okay. So we must have an integration, whether the mother is at the basic level or at the tertiary level of care. She is delivered at whichever level of care has to be given. So the integration has to take place between the family members, between the healthcare workers and the community around, as well as the other benefits and the support system which contributes to the mother's breastfeeding. Policy implementation and monitoring. Yes, so there are many, we will see further breastfeeding norms. There are breastfeeding acts which have come up in the benefit of the mother, and when the mother is benefited, ultimately the family and the community is also benefited. So the policy implementation and monitoring is another component which comes in the support system. Next slide, please. So the policy implementation and monitoring, that starts with the national strategies like those promoted by the global strategy for the IYF. We say infant and young child feeding. So right from the newborn to the infancy, the nutrition has been taken care of, and it provides the foundation for a long-term sustainability. So under the IYCF, which is infant and young child feeding, it starts right from the policies related to the breastfeeding, related to the weaning of the child and the complete nutrition of the baby. It's not only with the baby, but the mother who is breastfeeding her baby, the policies are also been implemented for her benefit. Health system integration. So baby-friendly hospital, I am sure you all must be knowing about BFHI. So baby-friendly hospital initiatives, which are, the most important, or we can say as a crucial touch points, because it has been followed by the hospital. In the BFHI, if you see the 10 policies which talk about the ideal breastfeeding, and here you will see that the major contribution is related with the mother and the healthcare workers, who themselves should first know the skills and techniques of breastfeeding, so they are in a better position to help out the mother how to give ideal breastfeeding. There is the rooming in. One of the point is rooming in, and she has to have exclusive breastfeeding and continue her breastfeeding. So this again in the health system integration, the BFHI is important along with the IYCF, which are crucial touch points which offer skilled counseling and support during the antenatal, intranatal or delivery, as well as postnatal hospitalization and even after discharge. Workplace and social protection, that is empowering the women in all settings, including during return to work, is essential to sustain the breastfeeding and achieving the gender equality. Social norms promotion, it should be visible, normalized practice. Okay, so whatever is the breastfeeding practices, a sustainable system promotes early and lifelong exposure to breastfeeding as a norm. So even in the societal environment, the norm, certain friendly, we call it as community friendly initiative. Okay, so community friendly initiative norms need to be promoted so that social awareness is there about the mother's importance of breastfeeding and the future child. Community based support, so it often hinges on support from peers. It starts from the family, as I said, peers, neighbors, and community counselors. And here I would like to mention in the community based support, even the peer group or the mothers, the other experienced mothers, I will say, who have an experience of breastfeeding, even they are there in the family also. It can be the relative of the mother who is doing breastfeeding. So she also plays an important role, to support the mother for breastfeeding. So they ultimately become either informal community counselors. Environmental and climate sustainability, where there is, breastfeeding is a zero waste, no use of any dabbas, no use of any powders or any bottles. Okay. So it is a zero waste, okay, low carbon, resource efficient practice that conserves the nature around in which we are living. Okay. So it conserves the water and energy while minimizing pollution and all those packaging waste. So these are the core components which WHO has given in collaboration with UNICEF. And it has been elaborated specially and counted into the support system that we are going to have a sustainable breastfeeding friendly environment. Next slide. So what comes under the sustainable support systems? So this part of the theme focuses, the sustainable support system means it focuses on this specific point, that is adequate maternity leave, lactation facilities in the workplaces, training for healthcare professionals on breastfeeding support. Of course, we do get training and we also have very good skills, to help the mother out for breastfeeding. But now we also we need to update ourselves, or we need to sustain our care, our support, our care by giving support to the breastfeeding mothers, right from the antenatal period. So this training for healthcare professionals is important. So training for healthcare professionals on breastfeeding support and community-based support systems. Next, please. We will start with the basic support system. So the family support is very important. Okay. So we always, of course, the couple or the parents are very happy when the mother delivers a baby. Okay. Obviously, the father is also very happy, but you also have to, or the father also should know his responsibility as a father, where he also plays an important role to support the mother during her breastfeeding. Okay. So the mother also requires an adequate sleep, mental peace. Okay. Even she's tired, during the intranatal period, whether it's a normal or an LACS. So the support should start from the partner himself. Okay. So the father can help her out, give her some breaks. Okay. Let her have adequate sleep and nutrition. So not only the father, but the other family members are also, all are very happy to welcome the baby. But once when the responsibility comes, okay, there may be a lack of support. So it's not, everyone should, distribute their responsibilities, and in the form of support, they need to support the mother as well as the baby. So the mother has to be supported, like she should have good nutrition, adequate sleep and rest. Okay. And whenever she feeds, she may feed the baby. So you can, contribute, or the family member can contribute by simply burping the baby. Okay. That also can be done. So she has fed, let her sit, let her have some rest, and by that time you can birth the baby. At times the baby may get up and cry, so the family member should go and cuddle the baby, silence the baby, and let the mother be healthy and have adequate nutrition and support and rest. Sorry. So this starts from the family support. Okay, the next support is the community support. Okay, so peer support groups. Okay, these groups offer a safe space for mothers to connect, because when she talks with another mother, okay, who already is breastfeeding, who already has an experience, okay, she will be more comfortable when she gives her a support, or she tells about her experiences. Okay, already she's got experiences, she may talk about what are the difficulties that she has, or maybe she has to start that how breastfeeding is important, and how it is very healthy and happy and good for the mother herself as well as her baby when she's giving breastfeeding. So these groups have a better impact as compared to the other groups. So peer support group is very important, which comes as a part of a community support. So it offers a safe space for mothers to connect, to share experiences, and to receive encouragement. That is another important, that the other mother who encourages her that yes, everything is good. It is a very good that we have become, or you have become a mother, you are feeding a baby, okay, with your breastfeeding, your baby is healthy. So when you give an encouragement, it develops a very good confidence in the mother. And when the mother develops a confidence, again, she starts with a very good breastfeeding. So that encouragement comes from the peer support group. So encouragement from others who have breastfed or who are currently breastfeeding. And then next is, now we have lactation consultants. Okay, so they are trained professionals who provide expert guidance on breastfeeding techniques. So we, in the hospital environment or the hospital scenario, we see that there are obstetrics who delivers the baby, and the babies, once the baby is delivered, we have got the neonatologist who looks after the baby, who takes her round. Nurses are there who are spending maximum time with the mother, okay, helping her out with the breastfeeding. But there may be some problems are obviously when sometimes the baby is preterm, the mother is delivered preterm, or the mother may be primey. She may have some minor or major problems with her breastfeeding. So we now, for a very good support, we now have something called as lactation consultants. Okay, so these lactation consultants are trained professionals who looks only after the breastfeeding part of the mother, antenatally as well as postnatally. Okay, antenatally, the counseling has been done, how she needs to prepare for the breastfeeding. And once she starts breastfeeding, okay, these lactation consultants, they do their job of, supporting the mother, encouraging her, teaching her the best techniques, how she can be at ease when she's doing her breastfeeding. Okay, and what are the various importance that when she's doing her breast or giving her breast milk to her baby. So trained professionals provide expert guidance on breastfeeding techniques, and there are some common or very minor challenges, okay, and which they are able to answer, they are able to solve their problem. And I have seen lactation consultants who really comfort the mothers during breastfeeding. Okay, so they are also a very important part in the community support. Then community health workers who provide education, support, and referral to other resources within the community. So we all know there are community health workers when the mother gets discharged and she's at home. Okay, the community health workers are coming in the community support, okay, where they will help the mother again to carry on the chain of breastfeeding and keep it sustainable. Healthcare facilities, so we have got childcare clinics where the mother again comes up for follow-up. It may be to her doctor or to the neonatologist. And also we have got lactation clinics, okay. There are many new lactation clinics which have come up, and even you can, give education or make the mothers aware that nowadays many pediatric clinics have got attached lactation clinics. Okay, so this is, we are trying that the community support becomes stronger. So an add-on lactation clinic is always available, or majority it is, and still coming up with a pediatric or neonatal or well baby clinic, we can say. With the well baby clinic, we have got lactation clinic attached. So this has added on to the community support. And online resources, so there are various websites, forums, and social medias. This is an example where we are, creating awareness in the breastfeeding week through media. Okay, so all these are coming as a community support. The next support is government initiative. So government also is responsible, or the mother is again an important, I would say, citizen in the this. So the government has got is responsibility. So they are really taking initiatives, and you must be very well aware about the first or the basic thing which is started with the Hirkani. Okay, so we are just talking about give friendly environment and support and all, but yes, still there are times when the mother, she herself feels odd when her baby is crying and she's in the in some area, maybe the bus stand or on the road or something, and the baby is really hungry, but the mother is feeling very awkward to give breastfeeding to the baby. Okay, so now we have got something called as Hirikani Kaksh, which, the mother, it may be a bus stand, it may be a railway station, even in the mall nowadays you have, even in the hospital OPD also you have, any centers you go, there is a small room called as Hirikani, okay? Because the mothers may not, she may feel awkward and she's not able to give breast milk to her baby. And obviously the others also around may have some other this. So we must, encourage, we must stop this, this myth, okay? So that is why the Hirkani, provision of Hirkani has been done, and which is really, really very beneficial. And, this guarantees that our mother will continue sustain with the breastfeeding support for herself, okay? So that is Hirkani. And National Health Authority should have a policy to indicate. So we are taking care of the mothers. We are talking about breastfeeding, but there are many other things also, like we, in case if it is an HIV, okay, there has to be a respectful maternity care. Okay, that is a separate topic. But also this also needs to be understood that the sustainability has to even followed in special cases, okay, or the special mothers or vulnerable mothers, example like HIV infected. So the mothers who are aware they are HIV infected should also be counseled on how they can do safe breastfeeding. So this also comes in a national initiative, and a very good part coming under the community support. Next, please. So in the public places, how you can encourage the mother, it's not that only you just put up a board of Hirkani or just a small room and let the mother go and feed. No, the mother also, when she feeds, obviously we have to see that the place is hygienic, the place is comfortable quite enough. At least she should be able, because I myself have seen many Hirkanis in the bus stand, okay. They are just, there are small 4 wood this and just Hirkani ka ek board lagaya hota hai, and the mother, somehow she manages to go and sit inside and feed the baby. That shouldn't be there, okay? So it should, at least she should have a good space that should be hygienic, where she feels herself to be comfortable, because when she's comfortable, she'll be comfortably feeding her baby. So, you can encourage and boost up, when you put up something like welcome. जैसे हम हमारे घर में रखते हैं, लगाते हैं दरवाजे पे, बहुत सारा ये welcome, and that gives a very good impression. Okay, the guest coming to your house, yeah, even हम लोग daily we enter our house and we have got a very good welcome. This, we are very happy mentally. We are very energetic. So same thing in the public places also. These should be put up at the entry of the Hirkani. Okay, that we welcome the breastfeeding here. Make yourself comfortable. Okay, feed your baby whatever, wherever you want, like that. So this just boost up, and the mother just enters with a smile and she's able to give feeding to her baby. Next, please. So the initiative and program, so I just wanted to talk about this, which is coming under the community support and also under the national initiatives and programs which have been started, so that our breastfeeding becomes successful, it remains sustainable, and also the friendly environment becomes safer for the mother as well as the baby. So we have got Pradhan Mantri Matru Vandana Yojana, which supports the pregnant mother. So right from the time of her conception, so it starts supporting the pregnant mother till she is lactating. So it supports the pregnant mother and lactation, okay, in the form of some remunerations, in the form of, free referrals, in the form of transport. So this is your Pradhan Mantri Matru Vandana Yojana. Then Ma, I know you all must be aware about this, Mother's Absolute Affection, okay, which has come up after your, ideal BFHI. So after the BFHI, there is a program called as MFHI, Mother Friendly Hospital Initiative, and this has been still refined further into Mother's Absolute Affection. So this is again nationwide program in India which focuses on promoting and supporting breastfeeding at community and facility levels. And here again, the Hirkani or the workplace rooms or support system is very strongly recommended under MA. Okay, baby friendly community initiative. So as we say, baby friendly hospital initiative, baby friendly mother initiative, like that we have got baby friendly community initiative, that at the community level, which provides support for breastfeeding mothers beyond the hospital setting, that is in the house, in the society, or maybe even the health center. So it is at the community level, so that is why it is called as community initiative. And overall, internationally, or the global network which covers all this, or which looks after, which takes care of the mother's breastfeeding is our WABA. Okay. So World Alliance for Breastfeeding Action. So this global network works to protect, it promotes and support the breastfeeding quite worldwide. So these are some of the initiative and program which supports or which are, very strong support system related to breastfeeding to the mothers. So these are some of the rights of breastfeeding in India. So India's Maternity Benefit Act, which was initially started in 1961 and updated in 2017. So this facilitates, or there is something called as creche facilities for the mothers, okay, when the mother is working. Especially this is applicable in governments, okay, when the mother is working, okay, there can be a creche, availability of creche at the workplace where she can keep her baby and then she can work peacefully. She knows that her baby is around, the baby is in the campus, and she can also concentrate on her work. Okay, so creche facilities where she can give time, and there are facilities for the mother to breastfeed her baby even when she is on duty. Okay, then Karnataka High Court 2018, where the rights of lactating mothers, they are highlighting in the article of 21 that every mother has got to feed her baby anywhere, anytime. Okay, she needs to feed her baby. So that is which is again included into 2020 updated. So Breastfeeding Act in 2013, this has come under the NFS, that is National Food Security, where it talks about, or it concentrates only on exclusive breastfeeding should be promoted. That is the first 6 months, the mother should only exclusive breastfeed, not even a drop of water to be given. So that is the meaning of exclusive breastfeeding. Okay, so this act has come, and it also provides the nutritional support where the mother receives free meals and nutritional assistance through various, centers. So this is the Breastfeeding Act, which is a part of National Food Security Act. And then there is a Republic Act number 7600, where it also helps out or talks about that the mother should practice, or we as healthcare workers should see that there is always a rooming in and bedding in. There is a term that we use nowadays. Rooming in means we understand that the mother and the baby to be together. But further, we also, the term has come is, I'm sorry, the term has come as bedding in. Bedding in means the mother and baby together to hai, but the mother and the baby should be on the bed, or wherever the mother is taking rest, the baby has to be with the mother. Okay, so that is rooming in, bedding in, and breastfeeding practices. So these are some of the rights of the breastfeeding that the mother, or we should be aware of, so that we tell the mother that these are your rights regarding breastfeeding your newborn. Next slide, please. So International Labour Act, okay, so there's an Article 10 which says when the mother, this is talking about the workplace support, that when the mother rejoins, or when she again, comes back for her duty on her work, okay, she has to be all the, whatever it may be, government, it may be corporates, it may be any companies, but they have to undergo, or they must know this International Labour Act. And under this and Labour Act, Article 10 says that the woman should be provided with the right to one or more daily breaks or a daily reduction of hours of work to breastfeed her child. Okay, so as I told you, in case if there is a crash in a workplace, okay, she can go and she can feed her baby and come back and start again with her work. Okay, she should not be stopped, or she should not be abused regarding anything that, about her work. So she should be given breaks. Okay, so the period during which nursing breaks or reduction of daily hours are allowed, and this is by the national law and practice. These breaks or the reduction of hours of work shall be counted as working time and remunerated accordingly. So it is not that the working hours should be considered only that she's worked for 4 hours and according to that the salary calculation is done. So she has to be given this liberty. She has got the right. I will not say it is liberty, but it is her right. So even if she takes breaks, whatever her daily work of hours is, 4 hours or something, it has to be counted as working time, and according to that, the remuneration has to be given to her mother, which is her right, as per the Act of 2600. Breastfeeding employees are allowed to breastfeed or express milk during work hours also. Okay, so even she can, express her breast milk, and she may send home in case if somebody comes to collect from the house, or if she feels that I need to remove my breast milk and keep it, she has to be provided, or the workplace should provide her with a room where she can express her milk, Okay, and use this during the normal breaks as a part of additional lactation break. So usually 20 minutes once or twice a day is agreed, okay, and the manager or whoever is the head or the authority, they have to understand and follow this International Labour Act. And allow the baby, so keep on the chain, continue, that is sustainable breastfeeding, but at the same time a friendly environment. So when the mother is been given this her rights, okay, she is in a better position to work also, so she'll be able to concentrate on her work, and she will also give a good production wherever she is working. So this is under the International Labour Act. Next, please. So this is a small, very good, ideal. I find this to be an ideal picture. Okay, so every workplace, this arrangement should be done for the mother, where the room is quite spacious. Okay, where she can even lie down, or she has to be comfortable. The temperature has to be very good. Okay, drinking water facility should be there. Obviously, she has to maintain her hygiene. The room itself should be very clean. Okay, very pleasant. When she needs to do hand washing, okay, so that also has to be there. A pillow to support the baby. There has to be certain disinfectant wipes which she can carry on her own, or it has to be provided in that room. A table to place, if in case she has to put her glass or whatever other utensils. An electrical outlet in case if she is expressing a breast milk with a breast pump. A stool for her comfortable, to make her feet comfortable, to maintain her position for breastfeeding, and a very reclining or comfortable chair. So once she's comfortable, then only, she'll be able to breastfeed her baby. So it is not only just providing a room or, giving a break, but all this needs to be ideally practiced. And then only it becomes an ideal support system for our mothers to breastfeed her baby. Next slide, please. So we have seen the support system starting from the father, the family, the community, even at the national levels, and where the mother, we have to make the mother aware about the rights, and we see that her breastfeeding really becomes very successful and happily. So then our role comes as a healthcare professional. So obviously we are trained, as I told you, about all the possible things about breastfeeding, how to do it, all the various techniques and positions and hygiene and all that, but at the same time, we need further training on how do we support the mother for her breastfeeding. So that training is required. And that is why, we follow all these webinars and various conference and all. The basic training is there, but now we should be ready, to add on and start supporting the mother for breastfeeding. Not only we as healthcare workers, but at the same time, we should also make awareness to the others that how breastfeeding is helpful for the society, for the community, for the nation also, and in which ways or how are the ways that we can support every mother who is breastfeeding. So that is training the healthcare professionals on breastfeeding support. Midwives and nurses are ideally placed, as I told you in the beginning, we are the frontline advocates for breastfeeding support. So we must get trained, we must understand all the support system and how we are going to keep on this a friendly environment for our mothers. So support for mothers and babies in the health facilities as well as in the community, and providing the mother with a respectful and dignified care. This has got, respectful and dignified care has got, a very major, we may not notice this, or whatever the healthcare workers or even the family members or even the neighbors or even the community people, a respectful and dignified care gives a major mental, support and comfort to the mother. And when she's at mental peace, or when she's comfortable, she becomes confident. I will always say this is a chain. When you make the mother mentally comfortable, okay, she becomes confident. Once she's confident and happy, she continues her breastfeeding more confidently. With the more confidence, she keeps on her breastfeeding very nicely, exclusively, and make her baby healthy. So that is, I just highlighted that we need to give a very respectful and dignified care right from the time of pregnancy. During delivery, we all know we are conducting or helping the mothers for delivery. It may be a cesarean, it may be a normal, and how much of pain that mother is undergoing. But at that time also, we need to keep our patience. We need to support the mother. We need to, tell her some tips and respect her, whatever she's undergoing during the delivery time also. So during pregnancy, during childbirth, and once the baby is delivered, so immediate time or immediate moments after childbirth, all this increases the chances that she will breastfeed her child very, ideally, comfortably and confidently. Okay, so team approach provides a robust set of skills to support mother and baby. Facility leadership, okay, so with experiences, with training, okay, you have to play or you become an advocate, and a very good leadership can be followed on, where you support the mother, adequate budget and integration of services. All these are the various resources. So even your support system counts on resources. So whatever are the feasible resources which helps the mother to support her breastfeeding, all that also has to be done. And this is our duty as healthcare professionals. Next slide, please. This is a small checklist which, when you are talking about, or when you are telling or giving health education to the mother, how ideally she can do her breastfeeding. And in case if she needs to do her express breast milk, this is a small checklist where even we will not forget, and we will be able to help out the mothers that what all she needs to, keep ready, or what are the things that resources she requires when she's breastfeeding her baby, or when she's expressing her breast milk. So this is just a short checklist. You may see that, okay, breastfeeding clothes, okay, then there are pumps that she can use, okay, the furniture which is there for her comfort in case if she requires the electric pump, all those things. This is just a checklist for us to know how we can help her out in a better breastfeeding. Next slide, please. Yes, so this is just I will talk about a circle which continues, okay, a chain which continues, that sustainability goes beyond the duration. Okay, we have talked about the family support, we have talked about the environment, the nature, we have talked about the resources. So this is just a summary that support at all levels, right from the family, at the national level, in regional level, local, which are very close to the mother, which are benefited for the mother as well as the baby. The health environment, the economy, equity, and emotional well-being. Okay, whether the mother is no discrimination should be there. Whether the mother is literate, illiterate, whether in the urban area or rural, even in the tribal or remote, it is possible that you give a good support to the mother with whatever available resources are there. Okay, so equity and emotional well-being is very important, to make your sustainable breastfeeding very strong. Okay, cultivating the breastfeeding culture that is normalized. Okay, so every woman, the other woman also, when she gives health education, we have to first tell the mother that this is all a normal phase of life. Okay, becoming pregnant and then delivering the baby and giving breastfeeding. Okay, at the same time, you need to add on with the proper health education, the importance of breastfeeding. So in the community level, it is very useful, and the mother can be encouraged to continue her breastfeeding. And across the system, if it is a working mother, and this especially in the urban areas or the urban regions, okay, and the policy are applicable, so the health system as well as the workplace and community. So this is how, at right from the mother level till the national level, the sustainability and the continuing of the support system needs to be continued. As far as we are working as health workers, tomorrow even in the informal way, wherever we are also a part of the community, you find any mother breastfeeding, okay, please keep it in mind to continue or to provide her with a friendly environment to encourage for or continue her breastfeeding. Next slide, please. So finally, I would conclude that creating a sustainable breastfeeding support system is not a short-term intervention. That is why I will always say that don't just celebrate that week. Celebrate every day, celebrate with every mother right from the antenatal period. Okay, so it is not a short-term, but we need to go on, keep on continuously, and more we need to keep supporting the mother. So it is a continuous, inclusive and empowering structure that safeguards the health, obviously starting from the mother to her baby and the future child or the future citizen of the country. So safeguard health of everyone, every individual. Protects the environment, so make it environment friendly also, and upholds the right of women as well as the child or the children. So when integrated across the policies, what we have seen, the various policies, the various rights, So all the integration of all the policies, integration of all the health systems who provide care, or the health workers who provide care to the mother and child, the various workplaces which are again important for the mother to survive, and communities. So breastfeeding becomes more than a feeding choice. It's not only a feeding choice, but your support, it becomes a pillar, a very strong pillar. We always say when there is a good foundation, a strong foundation, the human being becomes very strong. So similarly, it becomes, or we have to provide a very good foundation and a strong pillar for sustainable development to every mother of breastfeeding. These are some of the references referred. Okay. Yes, that much. That is how I wanted to just talk about the sustainability and support system.
Thank you so much, Dr. Samriddhi, for that thought-provoking and empowering session. You reminded us that breastfeeding is not just a biological process, it is a right, and it deserves dignity, protection, and support at all levels. We are truly grateful for the way you highlighted practical strategies to create a sustainable, respectful, and inclusive breastfeeding-friendly environment. Your talk gave us motivation to educate for change, not just in words, but through our daily clinical practice. Thank you once again for taking the time to be with us and inspiring us with the words of wisdom, ma'am.
I would also like to thank the complete team for giving me this opportunity, and hope I've given a proper judgment to whatever the topic given to me.
Yes, ma'am.
No queries? Anybody? Okay, thank you so much.
Okay, thank you so much,
And
ma'am.
yes, all the best
Thank you, ma'am. Thank
to
you so
everyone,
much.
and see that you keep on, be a very good, ideal health worker and help each and every mother related to breastfeeding and further as well. Thank you so much.
Thank you so much. Thank you. Now we are delighted to welcome our third speaker, Dr. Rupali Jain. Dr. Rupali Jain is a consultant neonatologist at MGM New Bombay Hospital, Vashi. She is an assistant professor in Department of Pediatrics, MGM Medical College, Kamote. Ma'am has completed her fellowship in neonatology from KEM Mumbai. Ma'am has advanced neonatal training from Australia. Ma'am has trained in emergency medical kids retrieval from Australia. And ma'am is a renowned member from International Boards of Lactational Consultant. Ma'am, over to you for the session, ma'am.
Hello. Good afternoon, everyone. I just want to confirm once, am I audible?
Yes, ma'am.
Okay, perfect. I will start sharing my slide. Okay, are the slides visible? Is the slide visible?
Yes, ma'am.
Okay, perfect. I'll start with my presentation.
Yes, ma'am.
I would like to give a big thank you to the MGM Nursing College for giving me this opportunity on the occasion of the World Breastfeeding Week in 2025 to be a part of such a valuable seminar where we can actually extend and share more knowledge regarding breastfeeding. I think it's a whole pool and it's an invincible topic, and it's there with us each day. We all are facing it, and with the patient, with our patients, with our relatives, with our family. We may or may not be confident regarding it. To be true, if we go through the IBCLC course, I had also done after I went through my own breastfeeding journey. So it seems ki since we are all from the health professional background, maybe we are more aware and people feel nahi aapko to aata hi hoga. That is what even I have heard from my own patients. But to be true, breastfeeding, I'll state it clearly, it's not that easy as it is projected by the people. Because usually a lot of moms feel a lot of pressure at home. It is being said, बच्चा हुआ है तो feeding तो हो ही जाएगा, उसमें कौन सी बड़ी बात है. And then she feels so much of pressure that she is not able to even say out to the family members, no, I'm not able to do it. Maybe there is some issue. Maybe I need assistance. People are not even aware that there is assistance available for breastfeeding. They feel, at least in India, it's such a natural process that you don't need assistance for it, or there is actually no assistant. People are lost where to go to. So this is where these assistant programs, where the awareness is most important, to make people aware that there are lactation consultants available all around you. You just need to take help of them and then have a safe and comfortable breastfeeding journey. So the topic allotted to me is common challenges of breastfeeding and strategies to improve the breastfeeding. Now, while I go through the topic, I would combine both the things. I wouldn't take them separately, because as we discuss the challenges, we will also discuss kind of a remedy or how can we improve it. Now, if you see on the right, it's a beautiful picture. I put it in every presentation I make for any lactation counseling, because it clearly shows what we all are talking about. It clearly shows a beautiful tree which has its roots deep rooted inside the mom's breast, and the baby is suckling on the mom's breast, and the baby is going to be the growing, flowering, blossoming part of the tree only when the baby breastfeeds well. So this typically shows what we all are actually talking about, re-emphasizing each time. And I think we should make sure we display it in all our wards, postnatal wards, in our nurse, wherever we have breastfeeding places, so that it reinforces in the mom's mind that whatever you're doing is the best for your kid. And so the best major thing that I want to put up is breastfeeding is not the sole responsibility of the mother, because as we discussed, as in the previous presentation, it was very well put forward that breastfeeding, it's a whole community effort, it's a national effort, it's by the employer, it's by the society, by the family. Only when everyone gives a good support to the mom, the mother can continue breastfeeding. Alone, if the mother is expected to manage everything on her own, she is likely to not continue breastfeeding. So, when we are addressing to the challenges at various levels, the levels can range from as low as the mother and the baby diet to the system at the time of delivery, the household, even the post-discharge follow-ups. Then, as we all know, breastfeeding has to be continued for minimum 2 years of age. Many of the moms these days are working, so the working moms usually start by 5 to 6 months of post-delivery that they say, now, ma'am, I have to join back. So we have to create a breastfeeding support even at their workplace, at community level. And there is something that I want to put forward, because there's a lot of influence of commercial milk marketing that is happening these days. So the slides are not very elaborate. I'll just like to mention they are quite point-wise, and we would discuss about each of the points in detail. So when we are discussing at the time of delivery, so
Excuse me, ma'am.
sensitization. Yeah.
Are you shifting the slides?
Yeah.
Ma'am,
I
we're
will
not
change.
able to. We are just on the third slide right now.
You are on which slide? The slide with the heading and the photo?
Yes, ma'am. The third slide.
Yeah. So I've shifted to fourth one now. Is it visible?
No, ma'am. It's still on the third.
Should I stop and start sharing again?
Yes, ma'am. Please, if you could do that.
Yeah. Just give me a minute. Okay. Can you see this slide?
Yes, ma'am.
Addressing the
Yes,
health
ma'am.
system at delivery level?
Yes, ma'am. Yes, ma'am. The
Okay,
fifth slide we can see right
the
now.
fifth slide, correct.
Yes.
Okay, perfect. Yeah. So the breastfeeding support and the breastfeeding knowledge to the mother has to develop right from antenatal period. When the mother are primed in the antenatal period, they are more likely to start and continue breastfeeding. If they find themselves with the lack of information, they are likely to delay breastfeeding and have a delayed initiation of breastfeeding. So usually there are a lot of antenatal classes happening at various health centers where the mothers as well as the family members both need to be involved, either the husband or the other caretakers at home, where a wholesome information about care of the mother, her physical health, her mental health, and how to initiate, start, and continue breastfeeding. All these have to be emphasized. Only when it is done at an antenatal level, it's likely to progress later to a longer time in the postnatal period. Second is early initiation of breastfeeding. Now, this early initiation is a very sometimes vague term. Some people say early initiation is like 4 hours after cesarean or 1 hour after normal delivery, but all these are old. The newer guideline says you have to initiate as soon as possible, immediately post delivery. So, as soon as the baby is born in a normal delivery, if the baby is crying well, even before the when the umbilical cord is cut, baby is kept on the mother's abdomen and the baby is allowed to suck freely. You need not wait for the pediatrician to check the baby. The baby is well, crying, thriving well. The baby can start breastfeeding immediately post delivery. There is no need to separate the mother and the baby. In fact, even in cesarean sections, even I am trying to practice in a lot of cesarean sections that I am attending as a pediatrician, that as soon as the baby is delivered, we cannot put the baby on the mother's abdomen, for obvious reasons, because it's all sterile. But the baby is taken clean, wrapped, and the baby can be brought in from the head and side, from the shoulder side to be true, of the mother, and baby can be initiated with the breastfeed, irrespective of the fact that the closure in the cesarean section is still going on. So you need not wait for the cesarean section, the procedure to get over, mother to shift to the recovery room, and then to start the breastfeeding. Right on the table, breastfeeding can be initiated. This is what is meant by early initiation of breastfeeding. Exclusive breastfeeding is a very important thing. Exclusive breastfeeding means giving only and only breast milk to the mother or to the baby. That does not include anything like Janam Gutti, which is very commonly given in India. A lot of places you have Baltaru, you have honey, which is given to the baby, some water, like, so nothing else to be given to the baby until and unless it's a prescribed medicine. Only exclusive is only and only breastfeed to the baby. Usually mothers have a lot of query like it's a very hot summer day. I think my milk is not enough or the baby's thirst is not getting quenched. So maybe I should give some amount of water to the baby. Even you have to re-emphasize to the mother that no, even water is not allowed in exclusive breastfeeding. Next is identification of physical issues. So this has to be started, initiated and continued during the immediately post delivery at home and even in the postnatal visits, because I have another slide on this. We are discussing in detail regarding the latch position and nipple areola complex issues, because there can be issues like the mother is having either flat nipple, retracted nipple, small nipple, the baby is not able to latch well, the position of the mother is not correct, she has some cracked nipple, mastitis. So these things can happen anywhere during breastfeeding. So mother should be made aware if she is having any of the issues as well as helped with the issues, because early correction of the issues is likely to continue breastfeeding for a longer time. I think in the previous presentation, BFHI has been very clearly presented. There are 10 steps of baby-friendly hospital initiative that every maternity home must follow in order to promote and sustain breastfeeding. The last is staff training. Only when our staff and everyone, that includes your doctors, your sisters, even your maushis who are there in the wards, they are well trained, can they promote and sustain breastfeeding. Because it is not a one-time event, as clearly mentioned. It has to be continued throughout the year, all the time long, so that all the new mothers are equally benefited by it. Sometimes our knowledge can be partly correct, sometimes we need upgradations in the knowledge, so this has to be continued each time. Okay. Has Just a small question, has the slide changed? I've just changed the slide.
Ma'am, right now we are on the 5th slide only. It's not changed.
I've just changed to 6th slide.
No, ma'am.
No?
No, ma'am.
So now?
Ma'am, the slide is stopped showing.
Okay, now can you see the 6th slide, addressing the mother and baby diet challenges?
Ma'am, if you want, can you WhatsApp us your slides so we
I've
can...
I've just WhatsApped the slides to
Ma'am, please allow me 2 minutes. I'll just transfer it on this PC and then I'll answer. 2
Yeah.
minutes, ma'am.
Yeah, sure. That would be helpful. Should I stop sharing then?
Yes, ma'am. Just allow me 2 minutes.
Sure. No, I'll just stop
Thank you, ma'am.
sharing.
Thank you. Ma'am, I hope the slide is visible to you.
Yes. Can we go to the next? Yeah, this one.
Okay. Kindly direct me for the next slide. So I'll just change it from here.
Okay.
Thank you.
So, thank you so much. Okay. So now we are addressing to the basic issues which I told you about is the latch nipple areola complex. So whenever we are saying about a good latch, it is when the nipple, if you can see the nipple and the posterior portion to the nipple is called the areola. The whole of the nipple as well as the big chunk of the areola has to be inside the baby's mouth. Okay, only then the baby can have a good sucking reflex and the baby can suck out milk of the breast. If the baby is only latched to the anterior portion or only to the nipple, then the baby is unlikely to extract enough milk from the breast, and that will lead to frustration in the baby because the baby is putting an effort but there is no milk coming because all the lactiferous sinuses are present below the areola which actually store milk. So what will happen? As the baby gets frustrated, the baby is likely to pull on the nipple. That can lead to something known as cracked nipples or sore nipples. You can see in the first photo where the mother has a crack, there is reddish discoloration of the nipples on the both the sides, and it is an extremely painful thing to have a cracked or a sore nipple. Because if the cracked or a sore nipple is present, every latch of the baby, every suck by the baby is going to be painful. And to be true, anything painful is not going to be continued by anyone, not the mother, by anyone for 2 years of age. She will get frustrated. No, it is such a painful procedure. I don't want to do it because doing a painful procedure 10 times a day is not very suited to anyone. So we have to reassure the mother. We have to tell her that this is not a normal thing. Cracked and sore nipple is totally because of improper latch. We have to correct the latch of the baby on the mother, and once the latch is corrected, this cracked nipples heal within 2 to 3 days. For the discomfort that she is having, she can apply certain emollients which are medically recommended on her nipple to help the nipple heal. So that can take care of this cracked nipples or the bleeding nipples. Now on the right, if you see the second photo, you see the nipple and around it is a large red area which seems to be quite edematous, swollen. Redness is present extending up to the chest wall. So this is basically a engorgement of the breast which has led to mastitis. Mastitis is inflammation in the breast. So engorgement of the breast can happen sometimes because when there is excessive lactation, but the mother is not feeding the breast, a baby well. So the breast gets engorged, and if the engorgement sustains for a long time, at times infection can develop or inflammation can develop that can lead to mastitis. Now, mastitis is also an extremely painful situation to have. Mastitis leads to a lot of pain, discomfort, and rejection by the mother to feed. So usually mothers are required, they are put on antibiotics for the same, they are put on pain relieving medications for the same, which are safe to be given in the situation of breastfeeding lactation. And the mothers are advised to give warm compresses on the breast. She is also advised to massage her breast. So usually massaging of the breast is done by holding two opposite sides of the breast and rotating. So this is how mother is supposed to massage the breast and then drain the breast towards the nipple using her palm. So this helps to relieve a lot of engorgement and helps to bring out the milk so that the engorgement reduces. The inflammation is taken care of by the medications that she receives. Now, a mother can breastfeed while her breast is engorged or mastitis is present. The usual common other issue, I faced this issue just a week ago. She was one of my colleagues who had it, is a milk duct or a milk duct block or a milk bleb. Can you see in the third photo down left where you see the nipple areola and there's a small white dot at the nipple. So this is usually a block duct. Seems very quite small, but it is an extremely painful thing to have. So whenever the baby presses and tries to suck, the mother feels an extreme amount of pressure and pain and burning sensation is what the mother describes. That and immediately once the baby leaves the nipple, the burning sensation is even more for next 15-20 minutes. To be true, my colleague described it to me as it was more painful than actually delivering the baby. So that was the amount of pain she had because of blocked ducts. So these blocked ducts usually earlier it was said you can take a needle, prick up the white dot and help drain the duct with pumping. But this de-roofing kind of procedure has now been abandoned. It's recommended not to do it because it can cause excoriation of the duct wall and can lead to cicatrization or closure of the duct. Instead, they are encouraged to put some Epsom salt in water and dip the nipple in that Epsom salt and for around 10 to 15 minutes and following which they can regularly pump. So this regular pumping and Epsom salt dipping helps to remove the blockages in the duct very easily. And as soon as the blockage is removed, the mother feels a lot of relief in the pain that she has because of the blocked duct. Now, the last photo on the lower right side is very commonly seen is an inverted nipple. Sometimes you have an issue of inverted nipple or flat nipple. There is another thing known as retractile nipple, where the nipple goes in, but if you pull out the nipple, roll and pull it out, the nipple becomes prominent. So retractile nipple is a bit still easier to deal with compared to an inverted arrow flat nipple. Because as we know, the baby does latch on the areola only. That only makes sure that the suck is good. But at times, baby slips out when we are dealing with an inverted and flat nipple. So in such a situation, we usually use a nipple puller, but to be true, I would discourage the age-old practice of cutting a 10 ml syringe, putting the plunger from the other side to pull out the nipple because it is an extremely painful procedure to be done. You have good nipple pullers available in the market. You can go ahead, seek a lactation consultation, get a nipple puller which helps to pull out the nipple and then try and latch the baby. If still the mother faces issue with the latchment, she can be assisted initially with something known as nipple shields, which helps the baby to create, which helps an artificial nipple to be created around the mother's nipple, which is larger in size and helps the baby to suck better. Once the regular sucking and breastfeeding is being practiced by the baby on the mother's nipple, the nipple automatically tend to come out a bit. Then the above photo, the top photo on the left, you can see is the tired, it's middle of the night, the mother is extremely tired, fatigued and stressed. So extreme tiredness, fatigue and the mother is a very poor situation where she has not received any support from either the family, community, people around, which leads to she feels overburdened and all this is going to affect her milk supply because anxiety, tension, stress, sadness, depression, all have a negative effect on the milk supply. Now, a lot of times there's a problem of perceived low milk supply by the mother. Now, at times the mother may be producing milk adequately, but she feels that the milk supply is low. She feels that the milk supply is not adequate to satisfy her baby's needs. So, we have to reassure the mother that your milk supply is okay, and you have to tell her that to make sure that the baby has at least 6 urine outputs in a day in 24 hours. Baby is stooling well. The baby's weight gain is adequate. You can call her for weekly visits to make sure the baby's weight gain is adequate, which will in turn reassure her that you have enough milk supply. A lot of times, what happens is she has heard a lot of things either from her friends or read it on social media, which is not verified, or heard it someone saying कि नहीं आप a lot of times I've heard is आप एक साइड से पिला रहे हो तो दूसरे साइड से टपकना चाहिए. आपका ब्रेस्ट से अगर फव्वारे जैसा दूध नहीं आ रहा है तो मे बी आप इनफ प्रोड्यूस नहीं हो रहा है आपको. अगर आपके ब्रेस्ट में टपक नहीं रहा है दूध उस जहाँ से आप पिला रहे हो बच्चे का, उसके बाद फीडिंग के बाद बच्चे को थोड़ा दूध निकालना चाहिए, तभी होगा कि बच्चे ने पूरा पिया है. अगर बच्चे ने दूध नहीं निकाला मतलब शायद उसको और भूख है. So there are a lot of myths related to this adequacy of breastfeeding that can be there in the mother's mind, which may be giving her a false sense of inadequacy. So you have to reassure the mother about what is adequate breastfeeding and how to make sure that she is delivering adequately. You have to remove the myth from her mind that there is no necessary that the other breast should leak or she should have really engorged breast. That only will make sure that she is breastfeeding well. So this when we explain the mother all these things, and this is not a one-time thing. Every time during postnatal regular weekly or 15-day visits, we have to make sure we re-emphasize these things on the mother as well as weigh the baby and give her the confidence. See, the baby is gaining enough weight, so you are having enough, so you don't need to worry. Can we go to the next slide, please? Now, there are a lot of household challenges, partly about which I have already mentioned, that there is an age-old practice of giving honey, gutti, or cow milk to the baby, which are known as prelactial feeds, which are highly to be discouraged. A lot of mothers are overburdened. They say after going home, I'll have to do my home, see the other child at home as well. घर का खाना भी बनाना है. I have to make sure that everyone at the house is fed well. I have to make sure the laundry is done, the house is swept. Now, if all the things are expected by one person, how is it possible that the one person is likely to continue breastfeeding? Then the easiest thing for the mother would be like formula banao, मुंह में bottle लगा, let me do the other work. So a lot of support from the family is needed to sustain and continue breastfeeding for a long time. And this support of the family can only be continued when the family accompanies the mother during the health checkups, and we make sure that this point is re-emphasized again and again by the healthcare provider or the lactation consultant or the community health workers when they are visiting homes and told that the mother needs to support breastfeeding. Actually, there is a very good practice in India that post-delivery, the mother usually goes to her own mom's house, does not go back to her own place, because somehow it happens that she is able to rest better. Somehow it happens that the rest that she needs, she gets the physical rest. She is not overburdened with a lot of work, which can happen elsewhere. That is what is felt otherwise. But I think with proper counseling of the families, both the families, whether it's the husband's family or the mother's family, both will be equally supportive to the mother for her work, so that she can continue breastfeeding for longer. Now, there are unsettled baby behaviors like crying, fidgeting, and short nocturnal sleep durations, which behaviors are actually normal. But a lot of time mother perceives as बच्चा बार बार ऐसे मुंह में हाथ डाल रहा है तो my child is hungry. Even after feeding, my child is putting the hand in the mouth, then maybe my feed is inadequate. The baby is crying excessively. Now, it's very important to explain to the mothers crying always does not mean that the baby is hungry. Crying can also be because the baby has just passed urine, the baby has just passed stools, or the child is just bored. Actually, children are also known to have dreams, so the child may have had a bad dream. So anything can lead to crying. The crying always does not mean that the child is hungry, and if the child is crying, you pick up the baby and start feeding. You have to reassure the mother that these acts are not always for hunger, and that does not mean your milk supply is inadequate. Can we go to the next slide, please? Now, this was what I was talking about. Ki whenever the mother comes for the postnatal follow-ups, so usually post-discharge, whenever she comes for follow-up, we have to make sure we assess the latch, whether she is having any breastfeeding issues or not, whether the baby is able to adequately suck or not, is there any pain, nipple areola complex issue, mastitis, engorgement, breast abscess, or anything which we feel which is not right. We have to reassure the mother that the weight gain of the baby is adequate. Check the physical health of the baby, check the stooling pattern, urination of the baby, and reassure her. This kind of reassurance is very important to the mother. It gives them a positive feedback that what they are doing for the baby is right and the baby is going in the right direction. So, this reassurance is very, very important for the mother. And maternal well being is also to be checked because mothers are at a very emotional state where they are likely to go into a lot of negativity can push them. They have the potential to going into a thing known as postpartum depression. So we have to really motivate them, encourage them, and congratulate them for the work that they are doing for their child and how well the child is doing because they feel really empowered, they feel nice, proud, and happy about what they are doing if they repeat a validation from outside. Now, if you have a healthcare group, you can also create a peer support groups. Like a lot of mothers can come in together and they can, help each other with the process of breastfeeding as well as taking care of their child. Because just yesterday there was a mother who came and asked me, "Ma'am, is it me only who is asking so many questions, or it's actually all moms ask? Am I weird that I'm asking?" So you need to reassure her, no, it is normal to ask questions. It is normal to have doubts. And the best part is you are clearing up your doubts. The best part is you are asking your doubts, you're not keeping them in your mind. Sometimes mother may hesitate to ask certain doubts to a certain person, even whom they know. But it is always helpful to, ask questions to people who are sailing in the same boat. So the peer support groups can be, which are obviously monitored by healthcare professionals, can be a real support to the mother that she is actually looking for. Now we have to encourage mother to eat a balanced diet, maintain hydration and rest well. Now mothers usually are very particular, घर में सबने खाना खाया क्या? But she has to be told that you have to look at your own diet as well. To be true, medically, there are no restrictions on the mother's diet that usually said you can have only this dal, you can have only this sabji. You can tell her you have a good balanced diet. Freshly prepared food at home is with a wide variety of fruits, vegetables, dals. You can have non-veg as well. Good amount of hydration, 2 liters per day to 2.5 liters per day, as much as thirst that you have. And rest, usually the common thing said to the mother is, please sleep when the baby is sleeping. I know it is not possible each time, but she should make sure that she takes at least adequate rest because baby requires frequent feeding. Her sleep may not get completed, which may also lead to some kind, at times, frustration in the mother. Can we go to the next slide, please? Now, workplace challenges have been beautifully described in the previous session, but I would just like to reinforce that we should make sure that the mothers get fully paid leave, at least 6 months of paid leave, which makes sure that mother is able to do 6 months of exclusive breastfeeding. If under my hands, I would even support a year of fully paid leave because the breastfeeding journey does not end there. The breastfeeding journey still continues, and we start with complementary feeding around 6 months of age, and then the breastfeeding has to be continued and solids have to be added. But at least 6 months so that exclusive breastfeeding can be continued. Flexible scheduling to accommodate breastfeeding. This, if possible, should be done. It depends on the nature of the work, cannot be 100% defined, but if possible, should be encouraged at workplace. Mother should be allowed to either breastfeed If the creche is available, she should be given breaks every 3 to 4 hours so that she can go and breastfeed her child, or she can at least express the milk and store in appropriate storage places. Now this expression of milk has to be made sure that it's a well, as in the previous slide we have, sorry, not in the previous, we had seen that it has to be in a good place. Now usually mother comes with a complaint that the expression they have to sit in the toilets and express. So I would highly discourage this kind of behavior, and the legislation should be put in place where the mothers can express in a very comfortable room and enough facilities to store and transport the express milk back to the home so that it is not wasted and used for the baby's nutrition later. It can be done. Details of the mother protection laws we have already seen, need not revise. I'll go to the next slide, please. Now, addressing to the community challenges. Now, we all have to make sure that any commercial, anything that is being visible on the social media. Now, there are multiple social media platforms these days that we have. We have Facebook, Instagrams, we have WhatsApp, we have forward messages, Pinterest, YouTube, and Twitter. So there is so much of information on these social media platforms. But the only thing is this, at times information at these platforms are not well filtered. It has to be monitored that what information is being put forward, whether it is correct or incorrect, and only correct validated information in the form of posters, videos, or it can be health talks between a professional and an interviewer can actually be promoted so that more and more awareness in the community is created. Now, I think to be true, we can also involve celebrities in these because people have a lot of influence by the celebrities. People tend to copy a lot what the celebrities are doing. So, usually the followers they see कि नहीं, this person has done certain thing in that way, so I should also do it in the certain way. So if they can be involved, the influential people can be involved with the promotion of breastfeeding, it is more likely to have a bigger impact on the society. Can we go to the next slide, please? Okay, these are just photo of the Mamta Kaksh and the creche at a workplace. This I've just shown you to show how at some places well mother support systems have been developed where the mother can breastfeed, take care of the baby in these centers, and the baby is also taken care of while the mother is busy working at her workplace. So this is like a support system for the mother, which are actually in place. Can we go to the next slide? Now, there's a lot of influence of the commercial milk formula these days. There is an ICMR code or the International Code of Marketing of Breast Milk and Substitutes, which clearly says that it has to be given only on prescribed basis, and misconceptions about the equivalence of commercial milk formula to the breast milk must be corrected. Even of any formula milk box that you see, it is clearly been reinforced to mention that the breast milk is the safest and the best milk for the baby. We have to even inform the parents who feel like no, the breast milk is inadequate, and some commercial milk formula have extra DHAs and extra some amount of calcium and protein, so will be better for my kid. We have to inform them about the benefits of breast milk. We have to inform them about what risk the formula milk can have on the baby. We have to inform them about the economic constraints with the formula. See, breast milk is natural, freely available, sterile at adequate temperature with all the nutrients that the baby needs. Formula, on the other hand, is man-made. Any during the preparation of the formula milk, if there is any break with the sterility, can lead to infections. Now, if the parents are correctly preparing the formula milk, that is 30 ml and 1 scoop, then 1 dabba that is available gets over in around 3 to 4 days only. So it's a lot of economic constraints on the family to actually sustain the formula feeding up to 2 years of age. then the formula can lead to, we all know the commercial, they does not have any immunological factors, which actually leads to improved immunity in the child. It can lead to a lot of gut issues, health issues, asthma later, currently as well as later in life. So you have to make sure with these clear wordings, you have to create awareness about the benefits of breast milk and about the demerits of the formula milk. Baby food companies have substantially increased their profits actually these days, especially in the upper middle class income group. Common infant adaptations to the post birth environment, like as we discussed, excessive crying, positing, waking up during the night, they are often misconceived as signs of feeding issues, and this is when the commercial milk formula marketing starts, that you give the certain milk to the baby and the baby will sleep better for you. So all these have to be clearly discouraged by the healthcare workers, by us healthcare workers in the community. Can we go to the next slide, please? So the simple take-home message from my talk would be is to normalize breastfeeding. Even if we see a breastfeeding mother, even in the community when we are walking about in the mall and we are, or maybe we are in the garden, instead of people, looking at her with a very down eyes, we should encourage her, we should congratulate her for what she is doing so that she feels motivated and she is likely to continue it later in her life as well. Sometimes I've seen a lot of people, making disgusting faces. Oh my God, what is she doing? So you have to create awareness that this is normal. If you can sit and have your sandwich or have your tiffin, even the kid can sit and have his or her own meal, which is breastfeed. So the thing is to normalize breastfeeding, not to make it something very weird, something to be done only under the uh, only behind the curtains, not to, no one can see breastfeeding. The more we normalize it, the more we are likely to continue breastfeeding in a sustainable manner in the community. Can we go to the next slide, please? These are the certain references that I have been through, and I'm happy to take any questions if there are any by the audience.
Thank you so much, ma'am, for such an informative webinar session for our webinar. And we are truly grateful that you took time out from your busy schedule and give us such an informative session on such a short notice. We would like to thank you for your insightful solution-based presentation that reminded us that breastfeeding, while it comes naturally, there are many struggles that we as healthcare stakeholders should offer help and inform with empathy support. The strategies that you shared were not only evidence-based and practical, but also came from a place of deep compassion. We really want to thank you, and it means a lot to us at MGM Enricon that you joined us today. Thank you once again, ma'am, for your time, your wisdom, and for being such a valuable part of our Breastfeeding Week celebration. We are truly and eternally grateful for this. Thank you.
Thank you. Thank you so much for giving me this opportunity. And I am hoping I did justice to the topic. And it was quite clear in the whole discussion what we are trying to put forward. Thank you so much for the opportunity to all the people who have organized the webinar. It's a great job that you're doing. And thank you so much.
Thank you so much, ma'am. Thank you so much. We at MGM New Bombay College of Nursing, or Department of Obstetrics and Gynecological Nursing, were proud to celebrate Breastfeeding Week 2025 with a series of fun and educational, meaningful activities that reflected this year's theme, that was Prioritize Breastfeeding, creating support systems. On day one, we had a grand inaugural ceremony that was followed by a thought-provoking skit by fourth-year BSc nursing students that highlighted the key messages around breastfeeding awareness. For day two, For day 2, it featured the screening of an impactful documentary, helping students and faculty reflect on the deeper social and emotional aspects of breastfeeding. Day 3 was filled with colors and creativity as students participated in a bright Rangoli and hand painting competition where postnatal mothers and Department of Pediatrics were ever so joyfully involved in this. Day 4 brought out the spirit of healthy competition with inter-college quiz competition with 5 enthusiastic teams that battle it out in the rounds of challenging questions, showcasing the knowledge and teamwork. The winning team was Team BVCon, and we congratulate them again. Day 5 focused on community engagement through a special quiz that was designed for the postnatal mothers, combining fun, awareness, and encouraging open conversations about breastfeeding in a respectful and supportive environment. Together, these events make the week both memorable and meaningful, a true blend of learning, creativity, and collaboration. With this, I would like to end my part and hand over the mic to Ms. Dipali Tengale, Assistant Professor, MGM New Bombay College of Nursing, Department of Obs and Gynae, to take over the mic for the valedictory ceremony. Over to you, ma'am. Thank you.
Thank you, Aradhana. Good afternoon, everyone, respected guests, speaker, and participants. I, Dipali Pingre, Assistant Professor, takes privilege to deliver the vote of thanks on behalf of MGM New Bombay College of Nursing for the webinar on Prioritise Breastfeeding, Create Sustainable Support System. Firstly, we are especially grateful to Dr. Mrs. Prabha K. Desilla for her constant and encouraging support for the webinar. Next, I express my sincere gratitude to the today's speaker, Dr. N. Gayatri, Dr. Mrs. Samruddhi Bhakre, and Dr. Rupali Jain for their impressive, engaging presentations and for sharing their knowledge and insights on different aspects of breastfeeding. Lastly, a big thank you to all the attendees for your active participation and insightful attendance. I also appreciate the efforts of our MSc Nursing students in making this event possible. We hope you found the session valuable and look forward for your continued support. And now I declare the webinar is concluded. Once again, thank you everyone and have a great day ahead.
Thank you so much, ma'am.
I request to leave the meeting